Good morning, Peter Goertz. I'm a psychiatrist. Horrendous experiences of patients, how to cope as a psychiatrist with hearing about all that. A patient, very young patient, became pregnant many years ago and married the man who had gotten her pregnant, and he was very abusive. And I was speaking with a family member who told me that the husband of the patient, quote, beat the baby out of her, and the baby died, of course. So the things you hear can be really disturbing, to say the least. Another patient many years ago I was talking with, he went to Vietnam for combat as a very young man, 18 or 19 years old. And an injured North Vietnamese soldier was begging for mercy, showed him and two other soldiers pictures of his family, children. And my patient was actually, they were told one of them had to kill him. And my patient, they drew straws and my patient lost. And he had to kill the injured soldier. And he'd come from a religious family. He was not prepared for anything like that. So he killed the injured soldier and suffered for many, many years, decades. I was talking with him many, many years later about that issue. You'll hear about people who've been physically abused for years, sexually abused for years. Sometimes people grow up in cults where there might be organized or regular abuse. And that could also be in state-run institutions, especially in the past. So organized, regular abuse in state-run institutions. People may have witnessed enormous abuse, for example, as children. And where I work, it's not uncommon for me to hear nowadays that patients' siblings have been killed, shot and killed, or even their adult children have been shot and killed. So on an ongoing basis, you're going to hear about things that are quite troublesome to hear about. On the other side of the coin, you're going to have patients, more than likely at some point in your career, who've abused children, who are murderers, who are criminals. So you're going to have perpetrators as patients also. The way I try to deal with this is to try and be aware and embrace my emotions, whatever they are: sadness, disgust, maybe even anger. And you don't want to let those emotions stop you from asking about trauma in patients. So one way psychiatrists potentially might deal with this issue is to just stop asking about trauma, try and avoid the issue, which I don't think is the solution from a patient's perspective. And an example was a patient had been admitted for substance use, but she told me when I saw her about recently being raped. So of course you don't want to ignore that. And if the patient does not want to talk about trauma, of course you want to honor that, respect that, and not talk about trauma. I often see patients in emergency departments, outpatient medication visits. So in those settings, you don't want to dwell on trauma. You don't have a lot of time, but you also don't want to ignore it. Often it's right on the tip of people's tongues, even after many years, to finally talk about the abuse. So it can be somewhat liberating for patients to finally talk about things that they may never have told anyone over decades. As a psychiatrist, it can be very helpful to be in your own psychotherapy. I've been in psychotherapy overall for quite a few years, on and off. And you want to digest your own emotions then, and that's in your own psychotherapy. One thing to try and realize, in my opinion, is the way it is the way it is. There's enormous suffering in life on this earth. And in my opinion, we need to accept that. That doesn't mean we condone it, but we need to accept that it is that way currently. And we want to, as doctors, decrease suffering. And that can mean very concrete things for patients. We don't want to forget to address very concrete, basic issues. So you may need to refer your patients to a social worker to address housing, financial issues, legal issues, insurance issues. And another thing is different people have different styles, but even in medication visits, so in brief visits regarding medications, I still like to do some psychotherapy, and I think it helps me with the psychopharmacological treatment to know my patients better and know about what's happened in their lives. So I think that also can be helpful for patients, even in brief visits. And of course, the medications we prescribe can be helpful for patients to deal with whatever's going on in their lives, even very difficult situations. Another basic important thing from my perspective is to be kind. Just be a human being, be kind, listen to your patients, even when they're talking about, of course, especially maybe when they're talking about horrendous things. And realize as a doctor, we don't have to necessarily think in grand schemes. If you make if you make one patient smile once a day, that's wonderful. Thank you.